Now mechanism of labor in right occipito-posterior position. So first of all, the lie will be longitudinal, the attitude will be that of slight deflection. The pelvis will also be a little different. It will be an android or an anthropoid pelvis instead of the usual gynecoid or platyploid pelvis. So android or anthropoid pelvis. And the head will be in slight deflection. So the diameters will be suboccipito-frontal or occipito-frontal. Now engagement will occur when the biparietal diameter crosses the pelvic brim. Why the right oblique diameter of the pelvis? Why? Again, because left oblique diameter is occupied posteriorly by the rectum. So again here right oblique diameter of the pelvis will present itself. Next, after engagement there will be descent due to good uterine contractions and maternal Berignon efforts. After that there will be flexion due to resistance by the pelvic side walls till the occiput touches the pelvic floor. Now if the pelvis is roomy and the baby is small, in that case there will be anterior rotation of the occiput by 3/8 of a circle so that it comes to lie behind the pubic symphysis. Now the neck cannot sustain a torsion of 3/8 of a circle. Hence the shoulders will rotate by 2/8 of a circle so that now only 1/8 of a torsion is left on the neck. Further descent will take place, further flexion till the occiput hinges beneath the pubic symphysis. Then there will be crowning followed by delivery of the head by extension followed by restitution. Mind you, the restitution will only be by 1/8 of a circle because that was the degree of torsion that is still on the neck. After that, there will be external rotation again by only 1/8 of a circle. Please remember this point that the external rotation will always be only 1/8 of a circle. Then there will be further descent till the posterior and anterior shoulders are borne in succession and the body by lateral flexion. Now this was one possibility out of 4 possibilities. This was when the pelvis was roomy and the baby was small. If the same thing had happened and the occiput had touched the pelvic floor but the pelvis was not as roomy and the baby's size was good enough, big, in that case there will be some kind of cephalopelvic disproportion and the rotation of the occiput will occur only by 1/8 of a circle. In this position itself there will be descent, but anterior movement of the occiput is now not possible. In that case, when nothing will come behind the pubic symphysis, then delivery is not possible. Hence, the head gets stuck in deep transverse arrest. It will descend down till the spines and then it will be arrested in that place itself. Hence, the patient will need cesarean section. So, this is deep transverse arrest when the denominator moved only anteriorly 1/8 of a circle. The third possibility is when the sinciput and occiput both are the denominators, they both touch the pelvic floor together. Hence there is no rotation at all. This is called persistent occipito-posterior position. In this case, there is no rotation at all. Again, this will require a cesarean section. Now the fourth scenario is when the sinciput touches the pelvic floor. This will happen when the head is very deflexed. In this case, the sinciput touches the pelvic floor before the occiput and is then pushed anteriorly behind the pubic symphysis, bringing the head directly in front of the sacrum. So this is direct occipito-posterior position. In direct occipito-posterior position, there is mechanism of labor if the pelvis is very roomy and the baby is small.